Donna Livingstone. Thank you for joining me this evening for the lecture on chronic pain in rodents. This is a radiograph of the guinea pig with osteosarcoma in the proximal tibia, just to show you that it is just a skeleton. And I'll go into that in a little bit more detail as we go on, but pretty much anything that you can see in more familiar species you are going to see in rodents. And if you do approach these creatures in a body systems based approach, then it makes it a little bit less scary. It makes diagnostics more obvious and treatment approaches more obvious. But today we're going to be concentrating on chronic pain. So what some vets, obviously not the vets that are listening to this webinar, but what some vets struggle with is why should they care about rodents, because a lot of them are traditionally short-lived species. But we do need to realise that the human-animal bond is not species specific. It really can be any type of animal. And at the end of the day, if an owner has sought your time and your expertise with their pet, if an owner has come in with their beloved animal and not immediately said to you, I want to euthanize it, they're there because they want your opinion. They're there because they want your help. It is not our job to x-ray their pockets. It's not our job to make financial decisions for them. It's our job to do our clinical exam to the best of our abilities, to discuss our findings, to give our treatment options, and help the owner make the best decision for them and their animal within the financial limitations that they may or may not have. But not only that, we have to remember that animals in the UK are protected under the 2006 Animal Welfare Act. And one of the points in that Welfare Act is that freedom from pain. So we are legally obliged to ensure that the animals under our care have adequate pain management. Okay, so just want you to pause for a second to think about that, because I know certainly I wasn't taught very well at university on chronic pain management, and it has become one of my many obsessions in veterinary medicine is trying to look for chronic pain in all my patients, regardless of species, and adequately manage that. So what is pain? I think it is useful to get into some definitions before we crack on with the more nitty-gritty of how to treat chronic pain. Well, if we look at the definition from the human side, from the International Association for the Study of Pain, pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage, or described in terms as such damage. Okay, or again from the human side, pain is whatever the patient tells us it is. Pain is a very individual experience, and the same types of pain will impact an individual differently. Okay, and that is the same in animals. But we're going to be talking about rodents, and rodents are prey species. And in prey species, they have evolved to hide pain. And that's an evolutionary adaptation, because if you hide a weakness, or flip it in the head, if you show that you're weak, a predator is more likely going to pick you off because you're an easy meal. Okay, so that makes it much more difficult to see pain in these species because they are not showing it in an innately human way. They are lying to us and telling us that they're absolutely fine. However, and also, sorry, I should have said, if you are a prey species, you've evolved to be food, because everything is food for something in the wild. So you can't show that you're weak, because that fear, that instinctive fear of predation is always going to be there. A lot of the species we keep as pets have not been in captivity for very long. Dagoes only really came into captivity in the 1950s, okay? However, pain assessment is easier in rodents if we remember that all vertebrates have the same anatomical and physiological pain pathways. So if it's going to hurt you, it's going to hurt them. If it's a chronic condition that humans find painful, rodents are going to find it painful. And so are our dog and cat patients. And although this is a lecture on rodents, I want to point out that the vast majority of what we're going to talk about is completely translatable to other species. Rodents are used as human models for pain, including chronic pain and the effects that chronic pain has on the brain. Okay, so that's fact. So if we're using rodents to look at how pain impacts people, well then it's having the same impact in rodents, otherwise we wouldn't be using them. Okay, and the brain regions that are activated in human pain when they looked at active imaging studies are also activated in rodent brains. And chronic pain causes a loss of grey matter in the brain, and that leads to increased pain sensitivity. So the same level of pain is experienced as being worse. So let's look at some definitions of acute pain versus chronic pain. And from the human side, the definition of acute pain is mild to severe pain of 3 to 6 months maximum duration and always within an expected healing time. But could I just point out, if we're dealing with a rat with an expected lifespan of maximum 3 years, and in my experience, 18 to 24 months is much more average lifespan for pet rats, 3 to 6 months of pain is a huge chunk of their lifespan for acute pain. What causes acute pain? Well, it's relatively easier to detect because illnesses will cause acute pain, trauma, surgery, infections will cause it. But we have to be aware that high levels of acute pain puts that animal at an increased risk of chronic pain developing. But acute pain is predictable and it's got a relatively short period and it may cause behavioural changes. Chronic pain. Sorry, having technical issues there. Chronic pain, the definition is mild severe pain of a duration longer than 6 months, past expected healing time and maybe lifelong. It's harder to detect. It doesn't have an anticipated start or a predictable end, and they're more than likely going to show behavioural adaptations as a way of coping with chronic pain. Okay, and acute pain has a protective function, because that's what's, you know, it's going to protect the area to give you a chance to heal. So it's making you aware that area is damaged and it needs to be cared for. But chronic pain has no protective function, and that is, it's a form of maladaptation, okay, of your pain system. So undiagnosed and untreated pain is a massive welfare concern. This is a radiograph of a Dago. You do not need to be a Dago savvy vet to look at that radiograph and realise that there's bilateral severe osteoarthritis. But not only that, it has a narrow disc space in its spine, okay? So it's got a massive impact on quality of life because these animals are actively trying to lie to us and tell us they're fine. And chronic pain has impacts on social interactions. It can disrupt social interactions. Remember that most of the species, the rodent species that we're dealing with, are innately social creatures, and there's been various studies that have shown that social contact can help them cope with painful or adverse circumstances, albeit it's acute pain. So if that animal is reducing its social interactions because it feels vulnerable and it's in chronic pain. Well, that can also lead to chronic stress. Sleep disturbances. We know that inflammatory pain, chronic inflammatory pain, especially leads to sleep disturbances. What's the most common inflammatory pain that these rodents are going to experience? Osteoarthritis. Emotional impact causes depression and anxiety. Grooming, failure to groom. This is a prey species. These are prey species we're dealing with. And in the wild, if you don't groom your coat, you no longer care if you live or die. Because in the wild, your coat is a requirement for thermal regulation to keep you warm, to keep you waterproof. So if you're not grooming yourself, you're going to be more risk of chilling, hypothermia, death. So as a younger vet, I was equally as guilty as many others at just stopping with the thought after, oh, it's not grooming itself properly, without then thinking of the actual implication of that to that animal. Chronic pain decreases the ability for memory and cognitive abilities, not just in people. All of these things happen in rodents too. And whereas with your myomorph rodents, your rats, your mice, your gerbils, your hamsters, it's only their incisors that grow continuously throughout life. Their cheek teeth don't, but hystricomorph rodents, such as chinchillas, dagoos, and guinea pigs, their cheek teeth also grow continuously throughout life. And uncontrolled chronic pain decreases their appetite. But it's subtle, okay? It's subtle. It could be as much as or as little as a few strands of hair less every day. But those small, subtle chronic appetite changes go unnoticed. The weight loss is slow and prolonged, and their guts are still moving absolutely fine. But they develop secondary dental disease because they're not eating the same. Therefore, their teeth are not wearing the same. So if you see dental issues as a new condition in aged hystricomorphs or rabbits for that matter, look for the source of chronic pain. So here's a 9-year-old chinchilla who came in, and we've got the overgrowth of the molars. If we, in chinchillas, if we draw a line from the upper border of the maxillary incisor to 3/4 of the length of the height of the tympanic bullae, there should be nothing over that line, so the yellow line there. It has to be a radiograph of diagnostic quality. What I mean by that, your tympanic bullae should be virtually overlying, and your mandibles should be virtually overlying, because if you can see both of them really easily, you can see them both in this radiograph. It's almost perfect. Not quite, but it's good enough. But if it was a complete oblique where you could easily see two distinct tympanic bullae and two distinct mandibular rami, that's not diagnostic quality for these lines. So you can see that we don't have overgrowth of the maxillary roots. Green lines in a normal chinchilla with a normal dental arcade would be continuous. You draw one green line down the cranial border, the rostral border, I should say, of the maxillary premolar and the mandibular premolar, and those lines should meet each other. But when you get dental disease, when you get clinical coronal overgrowth, you often get this stepping here. But this chinchilla had never had dental disease before. And if you are a species whose teeth that grow continuously throughout life, if you're genetically prone to dental disease and or you've been fed on a poor diet, you are going to develop dental disease at a young age, not an old age. So if you're seeing it as at an old age for the first time, there is something else underlying, so look for the chronic pain source. And in this chinchilla, we had narrow disc space in the spine, And you can see the end plates are sclerotic, and the ventrodorsal view confirmed it as well. But we also had bilateral osteoarthritis in our stifle.